Hello and welcome to this week's episode of Medisodes. Today we're going to be talking about kidney disease. So kidney disease is a disease that obviously affects the kidneys and it leads to reduced renal function. So let's start with some quick stats. Over 10% of the UK population has some stage of CKD, which is chronic kidney disease. There are 5 stages of kidney disease and they're based on the GFR, which Anupam will talk about later. There are over 3 million people with stages 3 to 5, which are the ones which are more concerning. CKD is more common in females and more common in people from African and Asian ethnicities. Age is also a big factor. As we get older, we're more likely to have CKD. There's also a geographic distribution. People, especially in the UK, from rural areas are more likely to have CKD. And this is unlikely to be because of the rural areas having risk factors themselves. It's more likely that older people tend to live in rural areas and younger people tend to live in urban areas, leading to the distribution of CKD being this way. So this obviously makes treating CKD and accessing those patients more difficult. CKD is a mild condition for many people, and people go many years without even knowing they have CKD. Now that we talked about a few statistics around CKD, Anupam is going to dive into the anatomy of the kidney.
The anatomy of the kidneys. So they're located high in the abdominal cavity in the retroperitoneal space, behind the abdomen on either side of the spine. The left kidney is typically between the T12 and L3 vertebrae, and the right kidney is slightly lower on the opposite side. And above each of these kidneys is located the adrenal gland. The kidney itself is a bean-shaped structure with a convex and concave border. A recessed area on the concave border is the renal hilum, where the renal artery enters the kidney and the renal vein and ureter leave. The kidney itself is surrounded by tough fibrous tissue, the renal capsule, and that itself is surrounded by perineal fat, renal fascia, and pararenal fat. The anterior or front surface of these tissues is the peritoneum, while the posterior or rear surface is the transversalis fascia. The functional substance or parenchyma of the kidney, so that's the inner parts, is divided into 2 major structures, the outer renal cortex and the inner renal medulla. Overall, these structures take the shape of 8 to 18 cone-shaped renal lobes, each containing renal cortex surrounding a portion of medulla. This is called a renal pyramid. Between the renal pyramids are projections of cortex called renal columns. Nephrons, which are the urine-producing functional structures of the kidney, span the cortex and medulla. The nephron itself is the minute and microscopic structural and functional unit of the kidney. It's composed of a renal corpuscle and a renal tubule. The renal corpuscle consists of a tuft of capillaries called a glomerulus and an encompassing Bowman's capsule. And the renal tubule extends from the capsule. The capsule and the tubule are connected and are composed of epithelial cells with a lumen. A healthy adult should have between 1 to 1.5 million nephrons in each kidney, so that's 2 to 3 million in total. Kidney disease, or renal disease, also known as nephropathy, is damage to or disease of the kidney. For example, nephritis is an inflammatory kidney disease and has several types according to the location of the inflammation. This can also be diagnosed by blood tests. Kidney disease usually causes a loss of kidney function to some degree and can result in kidney failure or the complete loss of kidney function, which is what we've been talking about today. One of the measures of kidney function used to determine whether a kidney is in kidney failure is called the glomerular filtration rate, or GFR. So the glomerular filtration rate describes the flow rate of filtered fluid through the kidney, or the sum total of all the glomeruluses within each of the nephrons in the kidney, and is determined by an equation where GFR is equal to urine concentration multiplied by urine flow divided by the plasma concentration. This is a simplified version of how it is calculated, and in most cases, all the calculation is done by machinery or computers, as it is very difficult, especially considering the variety of people and determining other extraneous factors such as age, size, weight, ethnicity in determining the final GFR. The severity of chronic kidney disease, or CKD, is described in 5 stages, with a 0 stage describing people who have no disease. And these are defined by this estimated GFR value, which is the GFR value calculated and then adjusted based on extraneous circumstances. And the first 3 of these also depend on whether there is other evidence of kidney disease when diagnosing. Another piece of evidence could be, for example, proteinuria, which literally means proteins present in the urine. So, like I said, 0 is normal kidney function. So a GFR score above 90 milliliters per minute per over 1.73 meters squared and no proteinuria, that means you do not have CKD. Stage 1 CKD is a GFR above 90, but with evidence of kidney damage. CKD2, or mild CKD, is GFR of 60 to 89 with evidence of kidney damage. CKD3, moderate, is GFR of 30 to 59. CKD4, which is severe, is GFR of 15 to 29. And CKD5 is GFR less than 15. Some people add CKD5 for those stage 5 patients who require dialysis. So that is essentially the stage where the kidney is almost unrecoverable and there are very few treatment options for saving that kidney. But how does kidney disease actually occur? For that, we'll have to move on to Surya, who's going to be telling you about the causes and risk factors for kidney disease.
Now, let's look at some of the risk factors behind kidney disease. The first risk factor we will be looking at is diabetes. Diabetes can increase the chances of developing a specific type of kidney disease called diabetic kidney disease. The high blood glucose in people with diabetes can cause the nephrons of the kidneys to become damaged. This is because high glucose levels causes the kidneys to filter too much blood. This puts extra pressure on the nephrons and damaging their filtering ability, which is the cause behind diabetic kidney disease. High blood glucose from diabetes can cause increased blood pressure, which is also a risk factor for kidney disease. The high blood pressure can cause kidney disease by damaging the nephrons, once again reducing their filtering ability, and which leads to various kidney diseases. Heart disease caused by cardiovascular problems is strongly linked to kidney disease. This is why acute episodes of heart failure can cause acute kidney damage. Obesity is also another risk factor for developing kidney disease. This is because the increased body mass in people with obesity means that their metabolic rate also increases. This can cause the glomerulus hyperfiltration, where excess amounts of urine is produced, and this can put excessive strain on the nephrons, and hence damaging the nephrons once again, and therefore this reduces their filtration ability, and this results in kidney disease. Age is also a really important risk factor for developing kidney disease. As a person increases in age, the amount of kidney tissue they have decreases, and the number of nephrons decreases in number. Both of these results in reduced filtration ability and results in kidney disease. Some of the most common risk factors include diabetes, high blood pressure, obesity, and increased aging. But there are also several other risk factors, such as smoking or a family history of kidney disease. Now on to Adrian, who will be talking about treatments for those with kidney disease.
Now, I'm going to be discussing the different treatments that exist for patients with kidney disease. These treatments focus mainly on alleviating the symptoms of someone with kidney disease, since there are no such cure as of now. Rather, the focus is to extend the lifespan of the patient as much as possible, while still providing them with the best possible quality of life. Lifestyle changes are among the first changes that doctors recommend to anyone showing any symptoms of kidney disease, regardless of how severe it is at that moment. Smoking is an independent risk factor for renal failure. Smokers are 4 times as likely to develop renal failure compared to non-smokers. Smokers have an increased risk of factors that are warning signs for kidney disease, such as protein in the urine, diabetic-related kidney damage, and almost double the rate of progression to end-stage renal failure from time of onset. The benefits of stopping smoking are often not directly linked to kidney disease, but rather come as an overall benefit to health that also happens to impact the kidneys. For example, stopping smoking reduces blood pressure, which reduces the risk of damage being done to the endothelium lining of the arteries, which in turn reduces the risk of atherosclerosis, and thus blood flow to the kidney through the renal artery will not be inhibited as much. Another lifestyle change that is suggested by doctors to those suffering from chronic kidney disease is reducing salt in the diet. In kidney disease, the kidney's inability to excrete excess sodium is a major problem. Since this excess sodium is unable to be removed from the body through the urine, the kidneys will retain as much water as possible in the bloodstream to try and dilute this high sodium content, and as such, reducing the concentration of sodium in the blood. However, the issue with not excreting sodium and instead diluting the blood is that it increases the volume of blood, so there's an increased amount of fluid flowing through the same constrained volume of the circulatory system. Hence, this increases blood pressure, which is itself a risk factor for several other health problems, including coronary heart disease and vascular dementia. This stresses the importance of a salt-controlled diet for those suffering from chronic kidney disease. The NHS recommends that a salt intake is restricted to less than 6 grams a day, which is around 1 teaspoon. There are several other lifestyle factors that are also recommended to those with chronic kidney disease, but these may not be as directly linked to the treatment as the two that I have just discussed in detail, stopping smoking and restricting salt intake. Rather, these other lifestyle factors focus on overall health, which is no less important in the management of chronic kidney disease, but is not as specific. No medication is specific to chronic kidney disease, but medication can help to control many of the problems that cause the conditions and several of the complications that may happen as a result of it. As I've mentioned before, hypertension, or high blood pressure, is a complication of kidney disease. Antihypertensive medication can be used to alleviate this high blood pressure. Specifically, ACE inhibitors, standing for angiotensin-converting enzyme inhibitors, are used for kidney disease. As implied by their full name, ACE inhibitors work by preventing the production of the enzyme angiotensin II, which is an enzyme that narrows the blood vessels. In people without problems with hypertension, this enzyme is beneficial in maintaining a blood pressure that is high enough to ensure the blood has sufficient force to be transported through the whole circulatory system. However, reducing the production of angiotensin II in those with hypertension will cause the dilation of the blood vessels slightly, which in turn increases the overall volume of the circulatory system and thus allows for a greater volume of blood to flow without increasing the blood pressure levels. People with chronic kidney disease are less effective at removing fluid from the blood, which causes it to build up in body tissues. This build-up is called edema. To help alleviate this issue, a patient may be advised to reduce their salt intake in the diet, and also fluid intake, especially through foods such as soups. In more extreme cases, a patient may be prescribed diuretics, medication that helps a patient urinate more, such as furosemide. Often, diuretics are avoided because their use has to be carefully managed. Improper management can result in dehydration and reduced levels of sodium and potassium in the diet. For a small proportion of people with chronic kidney disease, the kidneys will eventually stop working, called renal failure. This is associated with stage 5 chronic kidney disease, also called end-stage kidney disease. One of the options when chronic kidney disease reaches this stage is dialysis. There are two main types of dialysis, both of which I shall go through. The first is hemodialysis, which involves the diversion of fluid through an external machine, which filters the blood and returns it to the body. This is the form of dialysis that most people are aware of. Often, the blood is removed through a needle in the arm, passes through an external machine, before then returning to the arm through another tube. At dialysis centres, this is usually carried out 3 days a week, with each session lasting around 4 hours. The other type of dialysis is called peritoneal dialysis, which uses the inner lining of the abdomen as a filter instead of an external machine. This type of dialysis can be done quite easily at home. Not that hemodialysis cannot be done at home, but it's much harder to manage, and can be done while asleep. However, this type of dialysis requires more time commitment, since it needs to be done every day compared to 3 or 4 times a week. There are relative merits and disadvantages to each form of dialysis, and doctors will have to consider the individual case of the patient when they choose which form of dialysis to recommend. Dialysis is by far from an effective treatment for chronic kidney disease. It is an expensive, regular treatment that takes a massive toll on NHS staffing and funding, as well as severely affecting the lifestyle of the patient. A permanent solution is preferable, and as of today, the best solution for chronic kidney disease is a kidney transplant. This treatment is relatively simple in principle, with the idea being replacing a dysfunctional kidney with a healthy, working one from a donor. However, there is a large chance that the body will recognize the antigens on the donor kidney as foreign, and so will attack it, which renders the operation useless. Also, there's a shortage of donor kidneys available, and so the waiting list for a kidney transplant is long. People on the waiting list have to make do with dialysis treatment until a kidney becomes available for them. Indeed, a kidney transplant is far from the golden solution, but the best one we have so far. Patients often have to take immunosuppressant medication to reduce the risk of rejection after the surgery, which makes them more prone to the development of another disease. And, as with any surgery or invasive procedure, there is a small risk of infection during the surgery. Now, I shall hand over to Shrey, who will be talking about prevention measures for kidney disease.
So obviously, we don't want to be getting chronic kidney disease, and there are a few ways that we can reduce these risks. Firstly, as Adrian mentioned, a healthy, balanced diet, preferably with limited potassium intake, is preferable, and this will help to make sure that the kidney isn't being overworked and it isn't trying to remove loads and loads of toxins, which can reduce its function over time. Stopping smoking is also very important, as mentioned before, and that's due to the risk of CVD. If you want to learn more about CVD, please look at our episode on that. So alcohol is another thing that needs to be monitored. You don't have to stop drinking alcohol, but definitely you should stay within the 14 units recommendation per week. And preferably that 14 units should be spread over a number of days in a week, at least 3 days. You shouldn't be having 14 units all in one go. That's really bad for you. Also, it's important to exercise and just be active. Even if you have kidney disease, that's very important. But if we're trying to prevent it, we need to be exercising at least 150 minutes per week. And that's moderate to vigorous exercise, stuff like running, cycling, going to the gym. And exercise is shown to boost energy. It helps sleep. It strengthens bone. It reduces your risk of CVD, which is a risk factor for CKD. And crucially, it also leads to reduced blood pressure and hypertension, which is another risk factor for CVD. Also, many people who get CKD have other underlying conditions. So if you have diabetes, you need to make sure that your blood glucose is being controlled very well. You need to make sure that you're taking your insulin when you need to, and you're checking it at the correct times, and you're making sure that you don't become hypo or hyperglycemic. And staying with that range will limit the damage to your kidneys. If you have high blood pressure, taking medication that you're prescribed for that, such as statins, which reduce cholesterol, or ACE inhibitors, as Adrian said, are very important. It's important to take those medications to make sure that your blood pressure isn't going through the roof. If you want to know your risk of developing chronic kidney disease, you can go online to the NHS website, and then they have an online calculator which calculates your risk. So please check that out after you've watched this video. I hope you've enjoyed this week's episode about chronic kidney disease, and I hope that you can take steps to limit your chances of getting it. Remember to like, subscribe, and comment down below if you enjoyed this episode, and we'll be back next week for another episode.